We want these core values to help inspire you on, hey, how can you guys come up with solutions? These core values will give you the parameters, and then everybody within their own context. What one core value means to somebody in finance is going to mean something completely different to somebody in triage. It works because you have a binary system. Two things. One is we follow a system of loose constraints and high integrity. So it's a little bit complicated to understand, but not really. Loose constraints means, we're going to treat everybody like adults, and we're not going to have 1.2 million rules. We're going to define these core values, and so we're going to have few rules. We're going to have rules in place to keep things consistent, to protect us, to minimize risk, but we're not going to tell you every single thing to do, right? They're going to be rules, but they're going to be effective. High integrity. That means that we're going to hire by the values and we're going to fire by the values. So if we kept loose constraints, we didn't have a lot of rules, and then we didn't even stick by the rules or we didn't stick by the values, then it would be anarchy and chaos. So in order to have this system, it's like a seesaw. We're going to use these core values to allow us to identify things, the values, and that's going to allow us to have very few rules, fundamental rules that keep us going. But then on the other side, we're going to really stick to those things. We're going to hire by those values and we're going to fire by those values. It means they're open to interpretation. Again, one core value to the CFO is going to be different. That person is dealing with different scenarios. That same core value to an office manager is going to be different. So it's open to interpretation, but what it's going to mean for us is that we're going to value somebody's adherence or in their integrity to those core values greater than their output. So let's say I have somebody who's a performer and they're brand new. Now they're going to try to start IVs, and maybe they're struggling, and where everybody else can start 20 IVs in the same time period, this person is going to start only 10 IVs initially. Now when I start evaluating them, I'm not going to just say, okay, well, this person's 20 and this person's 10, get rid of the 10. When you say, well, what's going on with it? Well, that 10, they're really following our core values. They're trying to make that experience easy for the customer. So as they're doing that, they're kind of living by these core values. It's taking them a little time, but they're really applying those core values. Well, I'm going to have a higher value on those core values than somebody who's just churning it out. Because I know in the end, well, those skills are going to get better. If somebody is following the core values and it's taking a little longer, that's the person we want to keep. Because core values are more important. They'll get the other things. It assumes that people are adults and that rather than micromanagement, you just need inspiration, right? I would like to think that we have people who say, hey, listen, I'm going to put you on this island, we're going to give you the basic rules, and you guys run the roost, right? We're all adults. We want people to use their brains. In fact, we demand that people use their brains. If we find that people aren't using their brains, this is probably not the place for you. And so what that means is small violations, well, that's easy. Somebody's going to give you a warning. We're going to coach you, tell you how to do. Large violations are terminated immediately. If you've gone so far afield from our core values, it's not up for discussion, right? And somebody comes in as a patient and they're a 25-year-old female and they've twisted their ankle and they're hurting. Well, I'm just to make it easy, I'm a wonderful med tech. I am, just take my word. So I'm going to go in and to get to be a wonderful med tech, I have to know what I'm doing, right? I can't not know what I'm doing and be wonderful for the patients. It won't happen. So I know if I've got a 25-year-old female who twisted her ankle, I know a couple of things, right? I know she's going to need an x-ray. I know that if she's 25, I don't care if she just told me she had her period, unless she's had her female organs removed, she's going to get a pregnancy test, right? So I know a couple of things. I know if she's got pain, I probably should elevate and ice. I know that I'm going to have to put those orders in. I know that when I finish my triage, I'm going to take her to the bathroom to get that urine pregnancy test, and I'm going to let my team know, hey, Jane Doe here is getting X, Y, and Z. To make it easy for you, lab, I've already taken her to the lab and gotten the urine. I also know that my x-ray person, Matilda, is very tough. Matilda won't x-ray anybody unless they've got their bra off, they're in a gown. I already know that. So when I get her in the room, I'm going to make sure that she's in a gown and she's bra, because I just made it easy for my internal customer. And then I'm going to tell them, hey, patient's in room so-and-so, X-rays ordered, urine pregnancy's done, lab, hey, I've already gotten that for you just to make it easy for you, an X-ray, patient's already in a gown, etc. I just made it easy for my external customer, and I've just made it easy for my internal customers. And if everybody starts doing that, well then it starts, he starts paying forward. Everybody does that for the other person. So that's one of our core values. Another one is communicate clearly, candidly, simply, and repeatedly, right? In healthcare particularly, when you're dealing with sick people of all ages and medical histories that are incomplete, there's a lot of dynamic stuff happening. The more dynamic a situation is, the more vigorous your level of communication needs to be. That's why we have walkie-talkies, which are non-negotiable, right? You got to use walkie-talkies. I don't care if you're sitting right next to the person, you got to use a walkie-talkie, because that's how you learn to train yourself to use that tool, right? So communication has to be clear, candid, simple, and repeated frequently. Now, the thing that everybody usually nods, oh yeah, clear, simple, repeated, and people get nervous about candid. Well, let me take a second to tell you about candid. Candid doesn't mean that I go insult you, right? Candid doesn't mean that I take a swipe at you. Candid means, hey, I want you to take stock of this situation. We have a lot of sick people going around, and I've noticed that you're kind of operating at 80% efficiency. So I'm going to be candid with you and let you know that you're not making it easy and awesome for the rest of your team. So can you take a 2-minute break, pull yourself together, and get back in the game? Your doctor, right? And a lot of times you're only going to have one doctor per certain volumes, right? So that's a resource. So that means that you got to take a look at things. Should my doctor go into a room with a laceration and it's still got the classic, well, this guy just came from Gerald's Tires and he's got the tube sock wrapped around his thing, he's got blood, and nobody's done anything to it? We thought you'd take a look at it. No, because a doctor is the only one in your clinic who can sew. But a doctor is not the only one in the clinic who can get a wound prepped, who can get things ready, who can figure out what medications should be done. So you have to be thrifty with your resources. Make fun teamwork a priority, right? When I work, and anybody will tell you this, it's always going to be hard. It just is. We're going to do a lot. It's going to stay busy. But I hope that most people tell you that it's pretty fun, right? It's very busy, but it can also be fun, right? If you hate going to work because you don't like your team and it's not fun, that's not going to be a great place to work, right? Learn, improve, and repeat. That's basically saying we expect everybody to think about things and find better solutions, right? It's impossible to think that somebody's going to sit in an office somewhere far away and just map out the entire scope of things and that's it. The people who are on the floor facing the patients, who are dealing with issues, are always going to be the ones who are more in tune with finding solutions, right? You may figure out that, I have to use this walkie-talkie, but it's always going out, and if I had this other walkie-talkie, it would last longer. That would be smarter. Well, we need to know that. Or this printer is here, but I always have to walk around. If there was a printer right here, that would probably save everybody in this clinic 10 extra steps per patient, right? Those simple things are important. Don't wait to be asked, right? Who's ever been at a place and you hear the classic, oh, I don't think I'm allowed to do that. That's not my job. So that's an auto. When I hear that, my antenna goes off. This is not a place for you, right? This is not a place for somebody who feels like, well, I'm only supposed to do this, or they only ever showed me this, right? Because this person should apply rule number 5. Well, you need to grow, learn, improve, and repeat. This don't wait to be asked is the same as saying, hey, you should take the initiative. Start and end with high expectations. This is a critical one, right? What happens is people get pumped up after a talk, maybe they want, we want to do the best, and then life happens. And then it's, oh my God, it's 8:50 at night and this patient just came in and, You know, if they'd have come in at 8:50 in the morning with belly pain, sure we'd have done this, this, and this, but man, I gotta get out of here, I'm tired, right? I usually think that the best way I can measure a team when I work with them is how do they take care of patients in the last hour of the day? Because that tells me how good my team is. The next thing is bring energy, passion, and enthusiasm. This is a big one too. Now everybody, everybody has an off day. Everybody, if you've got kids, maybe they woke up really early or you're a little tired or something. So that's okay, you're gonna have a little bit of an off day. Fine. If you're consistently late, if you're consistently dragging your shoulders, if you're consistently slow, well then this probably isn't the place for you. One of the things that I do, and my little secret, and I'll tell you, is I watch how fast people walk. Urgent care is a full contact sport, right? And I'm not a young guy, but if I'm always having to go like this and then, can you keep up with me? That's probably not a good sign that this is the right place for you. This is a fast-paced place. And it's fast-paced when you have 2 patients, and it's fast-paced when you have 10. Thinking and reading and understanding and internalizing and starting to try to figure out what these core values are. I'm not interested in people memorizing 8 core values. I'm more interested in people figuring out, do they have these core values? And how can they apply these core values to whether you're an x-ray tech and you're walking somebody back and forth, how can you make it easy and awesome for them? Or whether you're, a med tech or a front desk. So have conversations, think about these things a little.